The students who statistically require the most urgent support are often the ones least likely to receive it. Inside K-12 schools, educators are managing a pressure cooker environment. They are tracking rising student anxiety alongside falling daily attendance rates. In Georgia, this pressure is now tied to a legal deadline. HB 268 requires schools to have comprehensive mental health support in place by July 2026. When students go without help, it isn't for a lack of effort by teachers or counselors. It happens because the pipeline for delivering healthcare is structurally blocked. This diagram illustrates the three specific choke points restricting the flow of care: distance, cost, and trust. Schools cannot reach the 2026 mandate if any one of these blockages remains. Success requires clearing all three simultaneously. Across rural Georgia, physical distance creates a massive hurdle. Many school districts are hours away from the nearest licensed therapist. For families without reliable transportation, a weekly therapy appointment is a logistical impossibility, requiring hours of travel and significant time away from class. This map shows how teletherapy bypasses physical geography. By providing secure video sessions at school or at home, MentalSpace provides same-day access across all 159 Georgia counties. Then there is the matter of cost. Many low-income families assume mental health care is an expensive luxury they simply cannot afford. This chart shows the impact of accepting Medicaid at a $0 copay. It makes therapy entirely free for Georgia's Medicaid families, removing the financial friction for the most vulnerable students. This barrier is removed for families with private insurance through the broad acceptance of carriers like Blue Cross Blue Shield, Aetna, Cigna, and United Healthcare. By digitizing access and neutralizing costs, a student's zip code and household income no longer dictate their ability to get help. Modern student populations are diverse, which brings us to the final barrier: the trust required for a student to open up to a provider. Students of color and those from immigrant families often face a cultural disconnect. They may fear that a therapist won't understand their background or will judge their family's culture. To bridge this gap, MentalSpace intentionally builds diverse therapist teams that mirror the demographics of each specific school community. When a student sees their own identity and culture reflected in their therapist, the bond of trust forms much faster. Solving the logistical hurdles of distance and cost is only effective if the student feels safe enough to actually speak once the session begins. We can measure the result of solving for distance, cost, and trust simultaneously, rather than treating them as isolated problems. This chart shows the systemic impact, an 89% measurable improvement in student attendance. Parallel to that, schools see a 92% recorded reduction in overall student anxiety. This framework scales to cover crisis intervention, violence prevention, and staff wellness, meeting every requirement for the upcoming Georgia mandate. By removing the specific barriers within the delivery pipeline, MentalSpace School ensures a child's background does not determine their access to healing.